Hello, everybody, and welcome to the Better You podcast. I'm joined by Robbie Patani as usual, and you'll recognize Dr. Tracy Tilton from some of our previous podcasts. But we're also joined by Dr. Erica Ortiz Pellicer. Am I saying it correctly?
Alice here. Yes.
Awesome. And we're going to talk about group therapy, specifically LAMCO Wellness's group therapy. Both of these clinicians do offer group sessions with LAMCO Wellness, and we're just kind of digging into what that looks like on a more person to person or person to many persons, since we're talking about group level. So, to kick things off, Dr. Ortiz, uh, tell us a little bit about yourself.
I come from a very diverse background. I would say that in when it comes to treating individuals and mental health, I started my career in community health. I would say that most therapists start in community health. So community is very much at the heart of everything that I do. And so when because I've been working in within community mental health for such a long time, I would say from about 2016 and forward, that for me, group therapy is just another way to engage the community in a large scale way, in a way where that impact goes from being from with one person, from an individual to a larger group, and then creating a support group for them in a therapeutic environment that is not just individual based, but can also put in community. So for me, I've been doing that for a long time, kind of facilitating groups anywhere from youthful offenders um, through adult offenders, depression groups, um, family groups. I did Healthy Start for a little while. I did family groups for the Department of Children and Families as well. So I've facilitated all kinds of groups. The latest being intensive outpatient services, and so um, I've gone through, my scope in individual therapy is anywhere from age 3 all the way. I think the oldest client I ever had was about 78. And the same thing with groups. And so I've had as young within a group, as young as 11 years old, and also as old as 78.
Awesome. So, Dr. Tilton, I know we usually have you on here kind of explaining um, various mental disorders to us. But in terms of you in a group setting, what does that look like? I'm so used to hearing kind of the, hey, this is the diagnosis, this is what it looks like, these are the so yeah.
Yeah, well, I've done groups. I worked at several state hospitals when I lived in Boston. And so we did a lot of groups there. I worked primarily with sex offenders there. So I did a lot of groups with them, which was interesting. It was just an interesting mix of ages and backgrounds and also a very diverse group. Um, so I found it like interesting to try to pull them in, based on their backgrounds, to still have them feel very included and be able to like support each other, even though they were so different in many aspects. And then when I worked in corrections, um, we did ton of group therapy. Many of them were required to go, so it's not like they signed up willingly, but still they were there, and I think I did a pretty good job getting them to participate. And whether they took any of those lessons and changed their life with them, who knows? I could guess, but I don't want to be negative. So, but they definitely participated, and we did like cognitive behaviorally based, um, you know, manualized treatment for the group as well. So,
I wanted to bring it back to the community aspect that you had mentioned, Dr. Ortiz. What was the outcome like when the first aspect of like, hey, were providing a group therapy, did people like, were they nervous to begin with, or how did they view that? Or same thing with Tracy, if you've done community group therapy as well.
You can go ahead, doctor.
Well, I will say, like, everyone goes into group therapy, in my opinion, a little nervous. They don't know what to expect, especially if they've been ordered to go there. And I'd like to tell them, well, truthfully, were you made to come here, or are you coming here because you want to comply with the requirements? And so this to me, and I will say to them, this to me is change talk. And to me, that sounds like you do want to change your life. So, welcome to group. And I always, this is one thing that I say to everyone is like, you may not necessarily want to be here. Okay. And maybe you're a little apprehensive, but I'm going to only ask you to do one thing: show up. And if you show up, I know that things are going to change for you. And then I will say to them, and if in 1 week nothing has changed for you, not a single thing, I want you to come back to me and tell me exactly what hasn't changed. And we're going to really take a look at it and actually see if you're just not noticing. And so when it comes to group therapy, I think that once you let them understand, hey, so you're here, don't worry about what's going to happen tomorrow or the next day. Just show up. Just show up. That for me is the biggest thing, where they go from, I hate being here, I don't want to be here, to, okay, well, I guess I'm going to show up.
Yeah. Yeah. I mean, I find one of the things I enjoy most about group is letting them know that there's other people who have gone through similar experiences, not exactly the same, but similar, and they can be a support system for each other. It doesn't mean, some people go to group and they don't want to say anything because they're afraid that like what they're going to say is worse than what other people said, or, that they didn't have the same experience, so no one can relate. But after a few sessions, I think it becomes apparent that they can learn from each other, and it doesn't have to be exactly the same to learn from somebody. It can just, you can learn from anyone about anything, really. So not just in group, but I like to emphasize that in group.
And that we learn from them as well. As providers, we learn from them. There's things that we don't know everything. And I like to remind them of that I don't know everything. But what I do know is that I'm so willing to learn from you in the very same way that you're going to be here learning from me.
Yeah.
I think one of the things that you brought up, Dr. Ortiz, that I thought was interesting is the show up part of it. One, because they're like in Illinois, there are a ton of court mandated group therapy places. I don't know if that's true in other states, but I know it's true here. Which I think, you have to show up. Like that's usually the extent of the court mandate. But it's also that I've been surprised how often in my life just showing up to something that I'm not at all engaged in uh, ends up teaching me something later. Um, like there's definitely been group sessions where at the time I've been that person who's like contributes if they get called on, almost like a cold calling in a high school class or whatever, but otherwise just isn't saying anything. And then like a few years later, I'll be like, oh yeah, I'm in this circumstance that we talked about in group, and I'm just now realizing how it applies to my life. So cool. So I do think that that is really key as people participate in both therapy and group therapy, is that, you know, a lot of times just showing up is very, at least in my experience, is very valuable. There may be a delayed value that you get from it, but just having that experience or exposure to it can be very helpful.
And I feel like the therapy by itself is a stressor for a lot of people. So going through group therapy, even if it's mandated, or not just seems a big stressor. Like, so like in your experience, like what have you seen? Like, how do you guys make the people like feel comfortable or like reach out to them in terms of like, hey, this is okay, you know, we'll get this through together. Yeah.
Well, I mean, I try to just reassure them that, again, they're there, so that's important. And then that they might be surprised by how much they have to learn from each other, and that by being there and just taking in the information, that's enough to, they might find themselves more motivated than they thought they were. And that you can really kind of leverage that into like getting them more involved. Because some people go there and like they don't want to speak, or they don't want to be the first one to speak, because maybe they've had no exposure to therapy, individual or group, in their whole life, and they don't really know what it consists of. Or, like if they're gonna get like told what to do or yelled at, or any other negative connotations. So if you can just kind of reassure them that this, explain to them in detail, like this is the process, this is what we hope to get out of it, this are our hopes for you, hopes for the way I teach it. And people are pretty receptive to that, I think.
I agree with that statement. In fact, I'd like to say to people who are apprehensive about attending group is that there's someone in that group that's gone through something similar like you. And you don't know that yet, but you will as we start to process things together, and as we start to share, and you feel comfortable and they feel comfortable to share. You feel like you're in a space where you're willing to share in their experience. And so when you're willing to kind of be in a space of what I say is vulnerability, even listening to those things, and I like to remind them there's someone here who went through something that you went through. And while you in individual therapy, you don't get to discover that. But in group therapy, you get to discover that, you get to understand. And sometimes we get to learn from someone else what they did in that same situation that might have been different, that can work for you as well. So that's one thing in learning how to problem solve, how to resolve conflict from people that were in similar situations. And maybe their situation has improved them. They changed things, the way that they approach things. Maybe it's things that you didn't even consider. I like to do an exercise with people in group, oftentimes, where someone will say, well, I have this problem going on, and I will ask them, well, if how could you support them? Like, what is something that you can suggest that would be supportive? And we will go around the room and say, hey, well, have you thought about this? And within these therapeutic realms, and then they say, oh, I never thought about that. And so they start to find and build rapport with other group members. Another thing that I like to do to kind of reinforce that group cohesion and that sense of belonging is I end every group saying, thank you for showing up for yourselves and each other. And so that starts to really strengthen some bonds, because I'm all about, it's okay. You don't have to say anything. Just show up. Just show up. And then when I say at the end of the group, thank you for showing up for yourself. And really, when you show up for yourself, you've shown up for these other people that didn't tell you that they needed you in that room for support, but you are.
Is there a time where like energy is such a big thing, where especially in a group, right, where seeing each other's energy, like, it's just, I don't know, in terms of like, it will not help their cause to get better. I don't know if you've seen that in terms of like, how do you like understand where they're coming from, and then achieve the positive nature of the conversation?
That's a great question, because that's when that requires and Dr. Tilton will probably attest to this. This requires some good facilitation
Okay.
where you start redirecting the energy in the group and the conversation in the group into a more beneficial therapeutic conversation. First of all, by acknowledging that that person who's voicing something has something to say, and that we hold a space for them and for that thought, but also an understanding that there's other people in this group that are vulnerable, and they need to be able to absorb this information without being overwhelmed. And so, that'll take, sometimes it'll take like, okay, I heard you say this. Can we talk about this? And kind of redirecting the group and reshifting things into things that are in alignment with, first of all, what you're discussing. And secondly, with what is beneficial to the rest of the group, so that we are trauma informed.
Okay.
Yeah, I think being able to reframe, especially when someone kind of has like a negative comment, or maybe kind of like going after another group member or something, like you said, to acknowledge what's happening, to ask each of them, what do you think is going on here, and to reframe what the negative comment was in a more positive light, and kind of try to turn it around based on that.
So we have a question from YouTube I'm going to throw up on the screen. How do I trust that the people in the group won't go home and tell all my business?
That's a great question.
That's
And at the beginning of group, like when the first session, you go over the rules of group. One of them is confidentiality, and that you don't talk about anything that happens in group outside of group, especially like if two members go outside and start talking about it, or like you said, go home and tell, who knows, all their business. And can we assure that no one does that? No. But it's one of the ground rules of coming to group. And if we find out that someone's doing it, then we're going to have a conversation with them about how this impacts other people and the group as a whole, and their ability to feel safe sharing anything in the future because of their behavior.
I agree. And also, one of the things that I find very useful and very helpful in getting people to understand how important it is to be the confidentiality of group is by explaining to them why this is expected, right? And so it's not just because of these privacy laws, but because each of us has a story to tell, right? And we don't tell everyone our story, right? But when we come in here, we've selected each other to be vulnerable with, to tell our story with, to tell our story to. And so that makes me special. That makes you special. And that person is vulnerable enough to share their story with you. And you are now the keeper of that story. So it's important for you to hold that story near and dear to you, because you've been made the keeper and to this story. And so it helps people understand, hey, what they've said to me, what they've said in group holds value, lots of value. And I shouldn't throw something valuable away.
Yeah. Yeah. And it's, the whole, with therapy in general, but whether it be individual or group, is that it's a safe place where people can discuss things that are intimate to them, or, like you said, make yourself vulnerable, and that people won't be able to do that if that safe space has been violated or diluted in any way.
Your suggestions were way better than the thing that I thought of, which was use a fake name. Less fun fact is that I actually have done that before in group therapy. I've talked about it on the podcast like almost a year ago now. When I was younger, in my early 20s, I had a bunch of friends, and we were drinking buddies. And as one of them kind of discovered he had a drinking problem, the rest of us were like, oh, maybe we should just kind of dial in on that and see where we're at as well. So I went to group, used a fake name because I'm in my early 20s and worried about everything. And I learned that addiction is so much more serious than I thought it was initially, and it for me, even being like going to group and being like, okay, I should probably stop drinking so much, but like I was able to walk out with more appreciation for people who struggle with addiction, which was a really hopeful thing for me. But yeah, my suggestion using a fake name probably not the best idea.
Well, I mean, you could always, like you could describe to them like how Alcoholics Anonymous works, and that it's confidential, and if you tell other people's things, then maybe you shouldn't be going, but you're not ready to go. I would never dissuade someone from staying in group, but just have a conversation with them about, this is a safe place, and by you not communicating with people's confidentiality, it just, it jeopardizes it for everybody. And I know, and like Alan, I know you don't want to do that, but that kind of is the effect that it has. So we kind of need to rethink where we're at in terms of, like you said, holding other people's stories close to us.
I wanted to go back to your guys' background. I feel like that is such a key factor in terms of the experience you guys have had in the past like few years, or like maybe 10 years or 15 years. And then what has that, is it the group therapy specifically, has that made an like impact on your personal life? In terms of you, like yourself, like have you learned like with all these emotions at the same time that's talking to you, and the feelings at the same time that's talking to you, have you like taken that into consideration, like when you're around your own family or your friends, like, okay, I should, have my therapist face on and just conduct.
Yeah.
There's
I mean, I think there's those moments where someone will say something that's like really surprising to you, or you just thought you would never hear them say something like that. And you, like I've in the past, like have processed that and was like, felt that I could use it in my own life, not necessarily like the exact same thing they were telling me, but a lesson they learned from it perhaps, or, just at some point, I think group leaders reflect outside of group on like what happened that day and how it went and what we learned as well.
And I'll say that I've learned from every group that I've been in. I've learned from at least one person something. And so, and that's why I said, a little earlier that I like to tell them, hey, so I'm going to learn from you in the very same way that you're going to learn from me. So maybe there's something that I don't know that you specifically taught me today. I've had in my group anywhere from teachers to lawyers and doctors in my groups, and I've learned from everyone. And I remember that at one time I had a real estate agent in my group, and she was talking about, her experiences and her stressors. And never did I know that there were so many property laws in the state of Florida until this lady sat in my group and was telling me how stressed out she was about all these property laws that I had no idea about. And so I like to know that when I go into group, I know that every group is different, that everyone that comes into group has something to teach me. And I like to know that everyone in that group has value, holds value in their experiences. And because of that, I can stand to learn from that. Right. Even if they were made to be there, there's something that they know that I don't know.
Yeah, and you can take what you learned from those group members and pass it on to future group members. So, it's like the trickle down theory, but for psychology, not finance.
The other thing I wanted to ask about group therapy in terms of like, feels like there's everything that's such as like the AA, like anger management and like depression. Are those all uses the same like psychology method? or there's a different way to get someone over through depression or anxiety?
Well, I think that the group process remains very similar throughout whatever the topic is.
Hmm.
Of course, you change the like didactic part to whatever anger management is different than depression or whatever, but to use the same listening skills, use the same communication methods. I mean, at least I have, and the same way that you try to draw out people to participate and stuff like that. Those are all like across the board skills that I would use regardless of the topic of the group.
Okay, gotcha. So there's no one specific method. It would be just depending on the group that you're conducting.
Yeah, that's how I do it. Yeah. I mean, I use like all like CBT evidence-based theory,
Yeah.
for everything. But yeah.
And for the viewers, just what is CBT?
Oh, cognitive behavioral therapy.
Okay.
And it's kind of people use cognitive behavioral therapy for many, many, many disorders.
Okay.
There's very few that it doesn't apply to. It's more like you're learning to like challenge your thoughts. You're learning, so you change your behavior then. And there's, a lot of, sometimes it goes along with like homework for group. They get a lot of different homework than like some other types of therapy don't do that as much, but cognitive behavioral therapy does.
Okay.
And it's important to note that there's all different kinds of groups. So when we talk about AA, NA, Al-Anon, those types of groups, those are support groups. And so there is no therapy happening there because it is a support group.
Okay.
But when we talk about, yes, and then so group therapy differs in that there is, in addition to support, there's also some counseling and therapy going there through evidence-based practices. And so when therapists, we love to say the word evidence-based, and here's why. Evidence-based simply means that that there were many, many, many studies done on this type of therapeutic approach, and that it has been proven to be helpful for whatever the conditions are. And so different types of conditions have different types of evidence-based modalities that work best. However, but what does happen in group therapy is actual therapy and support. You will, from Al-Anon, NAAA, you will receive support from a peer. And then of course, there are working groups, groups where, that you might have at work, or other types of groups where people come together to complete a specific task. So just to note that there are some differences, because sometimes people will come into group and they believe it to be more like AA, NA, and they may not understand the differences, but those are the basic differences between a group that you might find at NAMI or AA, where there's a peer leading it, facilitating and encouraging and supporting you, while in group therapy, you're going to be learning some things, you're going to be processing some things, working through some things with others, in addition to being supported by the group and your therapist.
Yeah, those are important distinctions.
Yeah.
So I have a question. It's really just based entirely on my own experience with group therapy versus individual therapy. I would personally, I would describe going to therapy as like taking a dip in very cold water. Like it can it can be helpful, but it's also like scary and occasionally really annoying and painful. But for me personally, and I don't know if this applies to everybody or even this analogy applies to anybody but me, but for me personally, I would describe like individual therapy is kind of the toe in kind of step down method where like you get up to your comfortable area and then you wait around for a while and then you go a little bit deeper. And in my experience, group is more like the dive right in, because like I haven't been to group, like full disclosure, I haven't been to group therapy nearly as much as I've been to individual therapy. But when I've gone to group therapy, like you get thrown in, and it most of the time, I'll say most of the time, there has been one where I was like, "Oh, I'm not going back." But most of the time it has been beneficial, and it's usually because there's like there's one person who shares everything without reservation at all, which I'm not equipped to do right off the bat. But like when I hear that, I just go, okay, I'm in this, and this is where we're at, and this is where we're all at. All right, let's go. I don't know if that's an apt analogy, but that's just how it works in my head. So I kind of wanted to get your thoughts on that.
Well, I can see why that you would use that analogy. I really can't because you are kind of just like jumping in with both feet. I hope not. A lot of people haven't ever been to group therapy, so or maybe therapy at all, but specifically groups, and so they don't know what to expect, and they think it's going to be like painful, and that they want to maybe, especially if they're like mandated to be there, they just want to get it over with. But through talented group leaders and like the topics are what you talk about are pertain specifically to those people so they can relate to them, then it becomes less scary. I hope for most people it becomes less scary. I can't speak for everyone, I guess.
I think that something that's really valuable about group is that, especially in conjunction with individual therapy, so it affords you the opportunity to go into your individual sessions, having gone through your experience, having been able to process your experiences while you're being supported, not just by the therapist, but again, by your group members. And then it allows you to go into your therapy session without with the ability to go deeper into that work that needs to be done. So, and then you learn all the skills that you need to get to that next session and the next session, and then work through that trauma, work through those things that are causing those problems in your life, because you are using group therapy as a form of educating yourself in how to get to the next session and beyond, and also on how to move forward in life, kind of like have the skills that you need to help regulate yourself, to help you reframe challenging situations, find silver linings in challenging situations. And so I will say that attending group is going to be an easier way to fast track individual therapy to where you can receive the treatment that you need on a timely basis.
For a lot of therapists, body language is such an important key into deciphering the feelings or the emotions. So this group therapy being a mental group therapy, like how does that work?
Well, I mean, you might not be able to see if someone's like their leg is like, if they're real fidgety from like, with their legs or something. But you still, I mean, people's facial expressions, they're sitting in their chair, just, some of their mannerisms and stuff, all are a great way for us to kind of assess how just using the nonverbal communication to assess, they appear really anxious, and maybe we can now talk about something that's not going to make them so anxious, and then gradually work up to the stuff that made them anxious. So I think you still receive those benefits.
Is a camera must on, or that depends on the facilitator?
Is the camera always on?
Yeah, does the camera needs to be always on, or okay, gotcha.
Yes. So we need to know that, first of all, that you're safe. And so we know that by being able to see your face,
Okay.
We also want to know that there's no one in the room, that you're in a private room. That's really important, not just for us, but for group members.
Yeah.
You know, they don't want to sit in a room and then you're sitting in a room with other people, or
Right.
you might be sitting you might be somewhere public. So it's really important to have the camera on. And then we go back to that place where this is a safe space. This is a place where you can be vulnerable, and we all hold a space for you. We can only do that if we know that you have done the same for us.
Gotcha. I
Yeah.
feel like whenever I see like group therapy, or in my head it's just a room with like chairs, like all the people are just so nervous. I feel like telehealth in a way like also like takes care of that, of people being able, and like with other people are surrounded by like other people, and they can have like a direct contact with therapists.
Right.
Yeah.
Yeah, that's a good point.
And you're comfortable at home. So it
Mhm.
affords you the opportunity to sit in your favorite chair in a quiet space.
Yeah.
It affords you the opportunity to come to group with a full belly and a happy heart. And if you don't have a happy heart, then it affords you the opportunity to tell us why in a
Yeah.
space that's all your own.
Of course. Yeah. You're on mute, Aaron.
I feel like I personally like the telehealth uh, option specifically because people can't see like my whole body. Um, like I'm a very fidgety person. I know, some of you might have seen it, but like under the screen, you don't see me like, going crazy, tapping my feet or playing with a fidget spinner, which I am doing right now. Um, or or any other number of things. It's just me kind of dialed in. So it's like me personally, as somebody who struggles with non-verbal communication, like conveying that I'm paying attention in body language, being able to, and I haven't done telehealth group personally, but I can see that especially applying to telehealth group, being able to kind of get my antsies out or spread wide or whatever I need to do to kind of feel comfortable without it looking weird to everybody else that I'm talking to is like it's very helpful. And I can see that especially being true in group because if I'm like if I'm in group and I'm just tapping my feet rapid fire while somebody's divulging their heart and everything that's going on, the appearance is that I don't care and I'm frustrated by how long they're taking to uh convey their feeling. That's not what's going on. It's just me being weird personally. But being able to kind of hide that a little bit and keep it under the desk, as it were, outside of the frame of the camera is very helpful for me. So
Yeah, because it can also be distracting to other group members too. If someone was like, foot was going crazy, and they might be like, "That's so annoying. I wish that person would stop doing that." And then, they don't have to deal with that on camera.
Yeah.
So that's a personal question. What are your favorite group types to do? I don't know if that's appropriate or even answerable, but I am curious.
I mean, I like to do the closed groups, so everyone can
Mhm.
start and finish together at the same time. I prefer those. I mean, I've done some open groups, but I really like the closed ones because then people really hopefully start to trust each other because it builds up over time. And then, there's it's like I just think it's easier to present the material in a way that's more conducive to learning when you have like, okay, this session we're doing this session, instead of having to like kind of incorporate people halfway through what you're going to do or things like that.
I agree with Dr. Tilton about the closed groups. as you know, they're a lot easier, I would say, to manage and be able to go into session, um, you know, successively, one topic to the next, to the next, to the next. I have facilitated many open groups. And so one thing that I found helpful is I always do a review of the previous session. So, and then we try to keep the concepts as simplified as possible so that if there's an open group, people can jump in and be able to, you know, really get something valuable about it, even though they're just stepping into a session that's been happening for a topic that's been happening for about 4 weeks, you know, or 3 weeks, you know, and then it's just building upon, but that it's easier. But I enjoy I enjoy closed groups, and another group that I really enjoy doing is groups that have to do with anxiety, you know, groups that deal with specific topics like anxiety, depression. And here's why: because when you're dealing with a group like that, everyone in the group can form a bond a lot quicker because they know that everyone in that group has the same problem, you know. And so because of that, there's really something to say about group cohesiveness and being able to see someone and learn from them, and particularly when everyone there has a similar problem. And then additionally, I especially love to see them say, I told my family about this, and you know what? I didn't know that they were depressed too. So now they want to come to group. And I'm like, this is great. Bring them. I mean, so don't go telling them everything that happens in group, but I love that you're sharing what you've learned. And so that's particularly helpful to me when everyone has the same problem and then they go home and share about it, and they share what they've learned and are able to find others who have the same problem and build a support system based on that.
Yeah.
Are there like stages of the group where like when you start and then like how do you know like okay it's time to end?
Like that particular stage and going to the next stage. I base it on kind of just like how the group is processing the information as a group. And you know, and then sending like all the material for that, you know, to check in with them and say like, you know, do you feel ready to go on to the next topic? You know, is there any lingering questions? You know, this is what my plan is, but I want to get your opinions too, because I don't want to close a certain topic if people still have a lot to say about it.
I agree. Like kind of measuring group readiness to move on to the next subject and move on to this next thing. Another thing is that we don't usually teach skills without having some practice in group as well. So that's also an important part of group where you're going to learn things, but we also want you to use them in group and outside of group. And that comes into lots of homework as well. So, you know, being able to use the skills in group effectively and efficiently. And that also helps us understand if it's good to move on to the next step of that particular skill set. This is particularly true when it comes to CBT and DBT, or cognitive behavioral therapy approaches, and dialectical behavioral therapy approaches, because they kind of one builds upon the other.
And then what if for a person it takes longer to digest the skill, and then other group members are ready to move on? Like, is there a dilemma that you guys face?
Yes. That is a dilemma I faced before. You know, because then the other group members can change the way they interact with this person. They might get annoyed with them, or might be not as nice to them, or pressuring them. So I think, just to explain to the group that every individual is in this group and should be respected, and we're not all exactly, we might have the same problems, but we don't all learn at the same rate. And so if we need to take an extra session, just, to catch this person up, or speak to them in maybe less jargon, then I would take the time to do that.
Okay.
Yeah, and also you want to figure out if there's something that's a particular barrier to them understanding what the concept. So, there is a good way to kind of ask, okay, so I heard you say that you're having a hard time understanding this. Can you tell me a little bit about, what part of this is most difficult? What do you think is standing in the way of you being able to, execute the skill, or being able to understand the skill? What do you think is standing in the way? And sometimes you discover barriers that really have nothing to do with understanding the skill, but mostly in the way that they are, that they're perceiving themselves and their ability to use the skill. And this is something that can happen a lot of times with, and I remember I was talking to Aaron about this when we first met, where, when as therapists, sometimes we can go into something when someone isn't ready for it yet, because there might be other people that are ready, but they're not. And so a good way to kind of level the abilities of everyone is to kind of start at a place where everyone is the same, in that we start to identify strengths and be able to build on those strengths to build resilience. And then they start to say, hey, I can do this. This is hard, but I can do it. And I talked to Aaron about something that I do as a therapist, is that I like to start my groups with strength-based therapy or positive psychology, to help build resilience, emotional resilience, so that when we get down to the core of the core subjects and approaches, that this person can go from a fixed mindset to a growth mindset, and understanding that they too have the ability to learn these concepts and implement them.
That's actually really awesome in terms of starting the group off with like the physical or just emotionally, well-being. So some breathing techniques that you start off with, or some core strengths at the same time. Yeah. So that's awesome.
This actually kind of relates to that, because I mean, in my experience, not everything, but so much of what comes with mental health, where it's like, hey, here's this thing that I do or don't want to do, that I really want to overcome, or whatever, stems from some, some trauma somewhere, some horrible thing, or maybe not even a horrible thing, but just thing that happened to you that was horrible, um, in your mind. And I've never gotten far enough in a group where I was, divulging my own personal traumas or anything. But I was always curious how that works in a group setting, because I I've been to parties and I've talked to people, or whatever, where they ask me a question that's a little too personal and they don't realize it, and I just give them the full answer, because it's like, all right, whatever, and then oh, that was fun, and then they just get really quiet, because apparently I went and said too much. Does that happen in group, and is that something you kind of have to work around?
It does happen. Actually, it happens a lot more often than we think, where someone's like, okay, I'm just going to tell everyone everything that ever happened to me. And some people are just not ready for that, especially if it's very traumatic, a very traumatic incident. And so I'd like to say that this is part of this thing where we do when we first start to, that norming and storming phase of the group where we start to kind of let people understand, okay, so when you come to group, the group is all about building your resilience. The group is all about teaching you the skills that you need. Group is about finding support. These are the things that are happening in group. And what happens in individual therapy is that all of these things that you weren't ready to talk about, that you're suddenly ready and equipped to talk about because you have the skills that you need to get through that discussion. And so I like to remind them that, so there's some things that we can discuss in group. And then there's some things that should be reserved for a talk with your individual therapist.
Yeah, no, I agree. Because, like you said, especially if it's trauma related, it can make other people very uncomfortable. And I want everyone to feel comfortable. And I mean, not that everyone's always going to feel comfortable in group, because I think how we grow is when, we're forced to challenge maybe some of our beliefs, and maybe that might make us feel uncomfortable. But you have to respect all the group members. And like you said, doctor, that some stuff is just probably better reserved for, individual therapy.
Yeah, and group therapy and individual therapy work best together. They
Okay.
work best together. And this is something that I say, like, if you are having a very difficult time and you've been in therapy for a very long time and you're not moving along, and you're kind of stuck, this is a great opportunity for you to get unstuck by attending group therapy. Group therapy is great for being able to move you in the direction of getting unstuck, where where you can discuss things with your individual therapist that you hadn't discussed before, where your therapist could do some very deep work with you because you are completely and you know what, I can't even say completely, but I will say that you are equipped and you have the resources and the tools that you need to again get to that next individual therapy session and the session after that, and so on, with confidence and also with the strength that you need to get through that.
Right.
I wanted to ask about the age differences in a group therapy, where like if let's say there's a 11-year-old, right? I'm sure it was a minor who probably needs a legal guardian to be in the therapy with him, right? Is that true or no? Or he can
No.
be okay. They can be by themselves.
Yeah, they just need a legal guardian to give them to give permission
Okay,
for
and
them
then
to be.
and then the rest of the group, there's different age ranges. Like, how does that impact? Is there? Have you seen a scenario like that?
I've never had a group where there's a huge, like with minors, where there's a big age range.
Okay.
And with adults, there's anyone from like, say like 20 to 78,
Okay.
and everywhere, any age in between. And I think I like that because people see things from such different perspectives depending on how old they are, and it can really be helpful to the other group members, for them to share those experiences that are kind of age based,
Okay.
but still have important lessons for people who aren't that same age.
Yeah. No.
I agree with that. I think that that when it comes to young adults, they really oftentimes enjoy hearing from others that are older and have gone through those experiences. And I'm like, oh, well, what happened when you did it? And things might be very different, but again, there's something to take away. When it comes to adolescence, is a little different because of developmental, appropriateness. So we want to look at that. It's best for everyone to be along the same developmental stages. And it can be, I would say that groups with middle schoolers work best with middle schoolers, and high schoolers work best with high schoolers. Sometimes there can be a mix. However, it's important for them to be about the same developmental stage.
Gotcha.
That just kind of brought up a really interesting thing about group therapy, because I feel like in general, nobody minds, and in some cases actively would be fine with talking to people of other age ranges. But I'll be honest, if like a much older person or even a much younger person than me just starts up a conversation with me, I'm immediately like, "What do you want? Please, like, like, guard is full up." And most of the people I know are like that as well. Where like, if you're not in the same age range, high guard. And I think that group therapy kind of brings in one of those situations where it's acceptable and in fact encouraged to have that lowered guard, so that you can start to get the input and wisdom of different ages, which I think is really cool.
Yeah.
It's part of showing up for yourself and each other.
Yeah, absolutely. Well, we are about at time. Thank you so much, Dr. Tilton and Dr. Ortiz, for joining us. This was a great conversation. Everybody who's viewing this, who will view this later, reach out to LAMCO Wellness, ask for Dr. Tilton, ask for Dr. Ortiz. Uh, you know, they have great insight to give, obviously, and a ton of expertise in the field. Don't forget to, like, subscribe, all that fun stuff, and we'll see you next time. Thanks.
Bye.
Bye-bye.
Thank you.
Thank you.